everyone, welcome to PHAMCAST. It's Margaret Wallace-Duffy, the visionary behind Preventative Health Awareness Month-End Movement, and this show. Preventative Health Movement has been recognized by Health Canada, and it is growing like you would not believe. It has caught fire, year 4 of FAM. And it's because of people like the person sitting at this desk next to me today that not only believes in this mission, but is breathing belief into it with their skills, with their passion, and with their servant heart. Dr. Dave Harper, who is a sports specialist chiropractor and trained in functional medicine, has been on PHAMCAST before, but it's always so good to get shoulder to shoulder with him again here on PHAMCAST. So welcome, Dave.
Thank you very much, Margaret. My pleasure and honor.
Well, you know what? It's so good to have you here. And I know so much has gone on over the last year since the last time you were here, and the momentum with the preventative health movement and the size of the family that's growing and the momentum it's having from, government officials paying attention, being talked about in the House of Commons, and having FAM flag raising. So I've got to give a shout out to Dr. Dave. Dave led the launch of FAM last year right on the border in Niagara Falls where he practices. And it was symbolic because FAM has even trickled over the border. I mean, although it's a proud Canadian movement, we have surgeons and nurse practitioners and other people in the US that are watching what we're doing and contributing to this movement. So we thought it would be good to have it on the border at Niagara Falls, and Dave led the charge there. And then this year, just last week, we raised a FAM flag in front of City Hall in Niagara Falls, and Mayor Diodati officially proclaimed every February moving forward, the first mayor in Canada to do it. Many others have proclaimed it for 1 year, but he has done it recurrent because he believes in preventative health. And Dr. Dave, I know you've been a really important piece of that. So I want to publicly thank you.
Oh, you're welcome. It's my pleasure and honor.
You're a very important member of the family, and I always love to learn from you. And you've got really cool ideas and different ways of looking at things. So let's dive in a little bit. For those that haven't seen the show before, tell me a little bit of background about how you became a chiropractor and this whole functional medicine thing, and why preventative health is important to you.
Sure. So when I was a child, my mother had an injury. And so we went to the chiropractor back in 1965. My grandfather, which I give credit to, her dad, had been a chiropractic patient since 1955.
Wow.
And it's because of what I saw between my mother and my grandfather that this whole functional medicine role has kind of come with me. My grandfather lived to 97 and 4 months old. He was only in the hospital for 17 days. He had the compression of morbidity. He had chiropractic care every month. He walked on a treadmill 10 years past the death of my grandmother. He was a Fuller Brush salesman in Oakville. And my mother, unfortunately, succumbed to dementia and Alzheimer's. She was in a home for over 2,600 days. So I got to see firsthand the difference between what it meant to have a member of my family live over 97 years and compress the morbidity versus my mother spend the last number of her years with that. And so I'm on a mission. To kind of bang the drum, to let people know that they can have influence over their own health future, because nobody knows what that's going to be. We don't have a time machine to see what's going to go on, but we want to have influence over that.
Yes.
And because of my background in sports injuries, I realized that athletes know their metrics. They know how high they can jump. They know their body fat, how much weight they can lift. They have a coach. They have different team members that support them in the way that they perform that sport. So whether it was an Olympic lifter or a power lifter, bodybuilder, hockey player, they really only wanted one thing, Margaret, and that was performance.
Yes.
They wanted to perform at their utmost. They wanted to perform on the field, on the ice, in the gym, whatever it was, to the best of their ability. And performance to them was all about strength and power. So how did they become stronger? How can they jump higher? How can they lift more weight? And so what I began to realize was that was really the essence, in my world, the way I describe it, the hero for their life. What that was the way to say how to have a good, strong life for the rest of one's life, because a strong human being should be able to live longer better.
You know what? Amen to that. You're
right?
Absolutely right. And that is in our control. I mean,
it's totally in our control.
We can't control a lot of the exterior factors. Yes, there's genetics. There's a lot of things that go into that. But there's a lot that we can control. And knowledge is power. And that's why I love what we're doing with the preventative health movement, is not just bringing education, but actual action through different means and through education in order to know your metrics, know your body. I mean, it's really interesting, isn't it, that people don't take they're not curious. Not all, but a lot of people have been trained to just wait till something is broken and then respond.
Yeah, if it isn't broken, don't fix it.
Right.
Kind of thing, right? And so we're living our life based upon our feelings versus facts. Right. And so I realized that, if you want to buy a new TV, you're going to do some research. You're going to buy a new car, you're going to do some research. But we haven't taken the time to research the most important asset that we have in our life, and that's this earth suit that we live in. And so I'm just on this mission to empower people to see themselves as lovable, to learn how to love on themselves, and especially from a men's perspective.
Yes.
Everywhere I've gone in functional medicine or in chiropractic, there's been a lot of talk about women's health. And women's health has been around in the circles of functional medicine for years, but men's health has really lagged behind, in my opinion. You have a personal story, and I have a personal story. So the idea here is to really understand what a man needs to know and how they can lead their family. They can lead by example, and from a servant kind of leadership. I'll share my own story, if I will, that I love to ride a bike. And you don't know this, but I love to ride a bike, and you talk about Rick and what's going on. I'm sure you've talked about that before, but I was a couple years ago with the Ride for Cancer. I wanted to ride the 200-kilometer ride in a day. So I said, I've been under some stress, some family issues, some practice. I've been in practice for almost 37 years. I want to have some type of cardiovascular assessment. So I got a cardiovascular assessment and found that I actually have a mitral prolapse. Wow. A mitral valve prolapse. It doesn't fully allow for the clearing of my left ventricle. It's asymptomatic, but it was found because I pushed to have an assessment done. So now I've had all the necessary diagnostics. I know exactly where I am. I'm on the bike every day. I'm following my body composition. I'm using wearables because I know that I have a weakness in this area, a bit of a broken heart, if you will. But I'm asymptomatic, and I don't want that to become an issue. So I want it to end well. And with a compression of morbidity at the end. And that was something that was discovered because I pushed for it.
Thank you for sharing that so vulnerably. And in these stories that we're sharing, that's how we get permission for other people to lean in and do the same. And it's not always easy. And I do want to talk about, you said a couple of things which I find interesting, certainly from the lens of a massage therapist. Said, a broken heart, as it were, right off the heels of saying you've been through a lot of stress and a lot of things. The mind and body are connected, and certainly in functional medicine, you won't argue this point, I'm sure.
Oh, no.
The mind and body are connected, but I also want to layer in the cultural piece about what it is, and I can't pretend to be, I'm not a man, but the cultural piece about being a man and manning up and being strong and sucking it up and don't be a burden and all those things. Let's speak to that, Dr. Dave, because I think it's really important to really not only give permission for men, but you talk about self-love, and it's not that men want to do harm to themselves, but it's not really something that's in our culture to say that you're worthy to push the envelope and to take care of you because you're often wanting to take care of others and just man up. Can you speak to that?
Yeah, so what I began to realize in my own life, and I'll speak from a personal perspective, is that I'm responsible for people in my life. I'm responsible for my family members, not only my father to look after him now, but I'm sandwiched between 3 kids that are in their 20s. And so for me to be responsible for that, I needed to see myself as being valuable, and I needed to get through that mentality of just push it, don't cry. It's not that I cry, but the point of it is just man up. It wasn't about the bravado of it. It was about the humility of understanding that I'm as human as the next person, and that in my humanity, there are no do-overs, there are no mulligans. You can't. There's not 2 passes at this, but I wanted to finish strong, and so that idea of finishing the race strong is kind of then the motif that I try to challenge men with. So how do you finish a race? Well, you need to make sure that you don't have a knee that's going to be an issue when you're running. You want to make sure that you're properly rehabilitated. And so my background in rehab, occupational health and rehabilitation and sports injuries management, that was all that the athletes ever wanted. So if we could see life as a sport and win at the game of life, how would that change our conversation and our language? It's now something that a man can understand, whether they're a hockey player or a basketball player or squash or whatever. If we want to win at that game, how do we train? How do we learn? How do we get exposed? How do we grab a team around us that helps us win at that game of life? And that's where the FAM network comes in, because that group of practitioners that are in that network, the network that I'm a part of, that I'm so proud of, we are that team for the human race, for people to win at that in compressed morbidity. We don't have, I learned watching my mother go through Alzheimer's and that your postal code will determine the level of care, in my opinion. So they lived in Tillsonburg. And so in Tillsonburg, where my father still is, bless his heart, my father is an amazing man. He loved my mother, even though she did not remember who he was, that he had been there the day before. He was there 5 days out of 7, right to the very end. A man who just loved my mom and loves his kids. And it was just an amazing example of what that love was all about. But we need to know that we need to take care of ourselves, because the resources that are available for these types of end-of-care realities, which is what preventative health is all about.
Absolutely.
We want to try and expand our health, and there's no way to expand health unless we add to it. You can't grow something that's not that you don't add to. So.
Yeah, and and thanks for sharing, and bless your mom and your dad, and watching that is hard. And when you were saying this, I was thinking about, you're taking care of others. Prevention is also, when you talk about self-love or self-respect.
Self-respect.
And I'm not speaking just to the men here, but if you don't take care of you, what example as a man are you showing to your kids or to the community or to your workplace? I think there is that, that man-up mentality. However, if we also look at it, how manly is it of us to care for ourselves first? Because prevention happens by those that are watching us too. This is a generational thing. And we need, for the future of health, those coming behind us and those that are gone ahead, they're not a lost cause, the ones going ahead. Sure, they're at a different stage, and we're having very different conversations than my parents had, or my aunts and uncles. But it's never too late, is what I want to say, and it's never too early to have prevention. And I loved what you said about, if you take care of you, you're also setting an example for your own children.
Well, 100%. And I found a family physician in the Etobicoke area that will order what I would like, and I do pay extra for the tests that I want to do, because I want to track my numbers. And again, that's the mentality of an athlete. We just had the Winter Olympics, and there's a peaking process. There's a training process. I'm intimately aware of what it takes for athletes to get there, because I would help to coach them and I would help to manage them, my Olympic lifters that would compete. But the reality of it is they know the metrics.
Yes.
They know what they need to get to. And so let's have a vision for what life really should be. Let's have a vision for the love of what life can be, so that we can matter to our communities, matter to our spouses, matter to our families, and matter for generations, and leave a legacy that shows that there's a proactive, preventative process to this that's intelligent.
Yes.
And
backed in research.
Oh, yeah.
And backed in outcomes, and the lack of the downstream impact it has on the cost of healthcare or sick care. I mean, it really is. We're doing this in real time, in real action, and actually seeing things change. Well, I keep saying this FAM plane, we're flying the plane and building it as we fly it. And that's okay.
That's okay.
And I recognize that this conversation and the system is a very complex thing. And I'm not downplaying the system that we live in. Thank God for the care that we get when somebody is acutely sick. Our colleagues in conventional medicine that are doing incredible work, the care that your mom, I'm sure, received. However, the ownership that we need to start to take for ourselves is lacking, and that's where we have an opportunity to change, and that's what these conversations, this movement is doing. So when you talk about power and performance, it's functional fitness and it's functional living, right? You can't. It seems so simple, but we've lost our way with making things more complex than they are. When you don't move, you can't move.
Yeah, and men have drifted away from that, and we've been challenged to drift away from that, and we haven't been really given a voice in that marketplace, I believe, in some ways, and we've just been told to stiff upper lip, and just take it, and just keep working hard and keep the feet moving, rather than taking the time to pause
and listen.
Listen to yourself. Listen to what was going on. I did have a bit of a premonition that I wanted to have this checked before I did that 200-kilometer ride, because I wanted to make sure at my age and stage of life that I was doing it in a wise way. Yeah, it was kind of interesting, and I'm the type of practitioner that will not do anything or recommend something unless I've actually tested it myself.
Right.
So I fully embrace the emotions of what it means to feel the sadness of my mom passing before she actually passed away, because I knew it was going to happen. I mean, I'm trained as a neurological kind of chiropractic kind of practitioner, so I understood exactly what was going on. And I have friends, I have colleagues, I have a network of people that have taught me in the functional medicine space. So yeah, I just challenge people that wherever they are to put their hand up and say, help me, or put their hand up and say, come alongside me, or put a shoulder around me. And yeah, I have a passion for men doing that.
Yeah, you know, and these conversations are so important. I mean, everybody, men, women, children, everyone from every age and stage of life, we all need to be a little bit more gracious in our conversations and being open to listening, and really not just listening, active listening, and hearing what people are saying and watching. You know, as a massage therapist, I'll lay my hands on people, and I've worked on elite athletes like you. I've worked on CEOs of companies and successful people and babies and everything in between. And the body and the mind being so connected, and the heart and the soul, it really deserves to pull back, you know, the veil and really look at the whole picture. And I think that's what FAM is doing now, to break down those silos and learn from one another. So just before we finish up this segment, we're going to dive in more here with Dr. Dave after the break, but why did you want to be part of FAM, not only just as a clinician, but as a human? Or better yet, what has the last few years being part of it meant to you?
Well, it's all part of a network. So my internal ecosystem of my body, the way my organs are working, all concurrently at the same time, need to handshake with my external ecosystem. FAM is a physician's ecosystem. It's various different practitioners from various different perspectives, all working together as different parts of the body of practitioners.
Yes.
And so I just resonate with that reality, Mark, and the work that you've done in that way, bringing us all together so that we can have a body that is fully integrated, that can show up and meet the demands of what the environment requires. And that's really what life is about. How do I adapt well? And so the people that you brought together in this network that I just had to be a part of are all part of that same kind of philosophy, that same kind of ethos. How do we all work together? You say, together we're better.
Yeah.
And my body is together better. I was born with a body that was amazing, it works in an amazing way, and it deserves that I look after it and care for it.
Yes, indeed. And that is something, you know, that I know people are craving this, and it's resonated for a reason. And we're seeing this year, in this pivotal year at FAM, that people of all ages and stages are not only putting their hand up and saying, but they're being drawn to. And part of that is because of community. And we're going to talk about that a little bit when we come back. But stay tuned, because Dr. Dave is a wealth of knowledge, and he loves to chat just like I do. And so we'll be back to talk more about all things men's health, performance, prevention, and working better together. Stay tuned. We'll be right back.